once again this next day of our seminar. Today, to begin, we'll have the keynote lecture by Professor John Helliwell. Before giving the floor to Professor, I would like to introduce him. John.
He is the Arthur Child Foundation Fellow of the Canadian Institute for Advanced Research and co-director with George Akerlof of CFAR's Program on Social Interactions, Identity and Wellbeing. He is also Professor Emeritus of Economics at the University of British Columbia, a member of the National Statistics Council, and a research associate at the National Bureau of Economic Research. He was previously visiting special advisor at the Bank of Canada in 2003-4, visiting research fellow of Merton College, Oxford in 2003, and of St. Catherine's College at Oxford in 2001, and Mackenzie King Visiting Professor of Canadian Studies at Harvard in 91-94. His books include How Much Do National Borders Matter?, published by Brookings Institution, The Contribution of Human and Social Capital to Sustained Economic Growth and Well-Being, published by the OECD and HRDC in 2001, and Globalization and Well-Being, published by University of British Columbia Press. Also as Mondialisation et Bien-être, published by Les Presses de l'Université Laval. Recent articles include Wellbeing, Social Capital and Public Policy, What's New? Wellbeing and Social Capital, Does Suicide Pose a Puzzle? How's your government? International Evidence Linking Good Government and Wellbeing. This is a publication joined with Heifang Huang in the British Journal of Political Science. And Social Context of Wellbeing, joined with Robert Putnam in Hooper, Baylis, and Cavern Editors, The Science of Wellbeing, published by Oxford University Press in 2005. He is Fellow of the Royal Society of Canada and an officer of the Order of Canada. So, well, regarding his vita, he doesn't need any more presentation, and of course, for all of you, he's a very well-known person, a very well-known scholar.
Today, he's going to talk about the topic, well, this keynote lecture about subjective well-being. So I'll give the floor to Dr. Helliwell.
Seriously. Thank you so much. Please, go ahead.
Muchas gracias. Can I be heard?
Yes.
This allows me to wander and to wave my hands. At some stage, I will probably want something to advance the slides, but for the moment, I'm going to do a bit of applied research to help you with the Here's the bit of research. Are you happy? It gets more difficult. If you're happy and you know it, clap your hands. If you're let's move quickly to the final stage of this. In order to do the science right, you're supposed not only to be clapping when I clap, but sing when I sing in language of your choice. If you're happy and you know it, clap your hands. If you're happy and you know it, clap your hands. If you're happy and you know it, and you really want to show it, if you're happy and you know it, clap your hands. Well, that wasn't too bad, was it? The science in this is that now I now ask you, are you happier than you were 2 minutes ago?
Yes.
On average, the answer is yes. And the reason is certainly not because I was singing to you. The answer is because we were singing together. And it's that doing things together, it has to be to good, if not to a good purpose, at least it has to be fun. Some combination of the two is what increases your happiness. It allows me to make a secondary scientific point, and this is really important based on the discussions that were going on yesterday. There was discussion about the tension between a subjective well-being, happiness on the one side, and the capabilities approach on the other side. And the reason, in part, that there is such tension is that Amartya Sen has not yet been convinced that the kind of data we collect in happiness research represents what he thinks ought to be collected and used as a core measure. Well, I think we're close to coming to the end of that discussion because there is now enough data of various kinds available. We can now put some empirical structure on what was previously a philosophical debate. Now, on the philosophy, it turns out Amartya Sen and I gave in the same day at the same conference in Rome in January, and completely independent talks, and we made exactly the same point. And we both appealed to a linguistic philosopher, and he chose Wittgenstein, and I chose my Oxford philosophy teacher, both of whom said exactly the same thing. And it was this, that there are two quite different concepts of happiness. And one is happiness as a mood, and then the other is happiness used in a judgmental or evaluative way. So one way of thinking about it is, the mood was, I was clearly asking you a mood question. Are you happier than you were 2 minutes ago? And you knew exactly how to answer it. So the meaning is intuitively very clear to you. The second meaning is very different but equally clear. If I ask you, how happy are you with the baggage retrieval system that they have at Heathrow, as in the famous old BBC series, you know exactly what I mean. You know I'm not asking about your mood. I'm asking you to make a judgment about something. And so when Amartya Sen then says, and what did he say in Rome? He said it's that broad view of happiness that is the happiness that I think Amartya Sen thinks ought to be central to the evaluation of life. But he thinks that the measures of happiness that are collected and used are simply emotional reports, and therefore they don't tap in to the deep structure of life, which of course is fundamental to the capabilities approach. And in some sense, that belief about what people respond when they're asked how happy they are is what fuels the notion, the sort of happy peasant notion, which is also associated with Amartya Sen, that here are people who say they're happy, but I know they have no business being happy because they don't know what they're missing. It's oversimplifying, but it's of that sort. So some combination of ignorance and adaptation, they say they're happy when in fact the circumstances that suggest they ought not to be happy. Well, this philosophical distinction, plus the fact that the worldwide collection efforts have now proceeded far enough, we can analyze scientifically those philosophical distinctions, allow us to settle that debate, I hope, for once and for all. I invite your judgment on this matter. How do we settle the debate? Well, we look at actual affective reports of happiness, and we find that they do indeed respond to the here and now, as they did with the singing. And we find, for example, that people are much happier in terms of how happy were you yesterday on weekends. This is a big US sample of millions of people. Then they're happier when they're asked about the weekend days, when they're asked about the weekdays. If you ask them for their overall life evaluation, the Cantrell ladder that Ed spoke of yesterday, that's entirely unaffected by the day of the week. Now let me bring it closer to home. The European Social Survey, bless their hearts, ask not only, as does your NEGI survey, how satisfied are you with the life life as a whole on a 0 to 10 scale, but how happy are you with your life as a whole on a 0 to 10 scale? And we find that using happiness in an evaluative way, as that question clearly does, gives exactly the same pattern of answers as does the life satisfaction question. And more importantly, when talking to Amartya Sen and people who have been brought up in his tradition, the answers that have real weight in determining life satisfaction and happiness about life as a whole, the evaluative measure, are precisely those variables that Amartya Sen holds highest. To the extent they're measured in surveys, for example, all the capabilities come through, healthy life expectancy, education comes through, but mainly instrumentally, a sense of freedom to make your key life decisions enormously important. So essentially all of the fundamental capabilities come through very strongly. If that were not true, we wouldn't be able to explain what to us is natural now, but would have been a surprise to Amartya Sen, that the people he regards as too ignorant to be unhappy, in other words, adapting well to very bad circumstances and not knowing what they're missing, they ought to report on the Cantrell ladder just as high a score as the people in Denmark or any other country of the world. But of course, as you were shown by Ed yesterday, and I will show you in slightly more detail now, that's of course not the case. The average value in the bottom 4 is 3.4. The average value in the top 4 countries of the world is over 7.6. And the differences between the two are explained by variables that include not just the key variables in the United Nations, the UNDP quality of life measure that Amartya Sen thinks is crude and imperfect, but nonetheless closer than any of the subjective measures we'd talk about. But add to that the fundamental measures of capabilities that are precisely what he regards as important. Well, to be able to move the capabilities approach from a top-down, this is what I say is important, to something that bottom-up, that is rationalized by, explained by, and given relative importance by actual evaluations of people's own lives, is for statistical agencies and scientists extraordinarily important. Because you then ask, how can I talk about the structure and fabric of life in the country where we live? These evaluations can be as fine-grained as you want and as tied in as closely with programs to change this or to change that, or ideas about changing the life in a hospital ward or the structure of a classroom or anything else, and then linked to these national data in a way that you have much more scientific confidence in than you would otherwise. So these data are enormously powerful at being able to bridge high levels of aggregation and the tiniest level of micro concern in a way that's scientifically comparable. So it's not just a philosophical discussion we're having now about the tension between the capabilities approach and subjective well-being. I think there is no grounds now, on scientific grounds, for that tension to be there. And it's up to us as scientists to make that clear, or to make it increasingly clear. After all, some of the data that have allowed these points to be nailed down have only got a currency in the research world of 3, 4, 5, 2 years even. That very important in that, and I would encourage you as a statistical agency and scholars here to think about this. Don't always just go for single measures in your surveys. Do what you can to aid the science by making sure that you have different ways of measuring, even if you think conceptually one measure of the quality of life is what you're after. We find, for example, although this was done for different purposes, the Gallup ladder was giving different results than was the World Values Survey for some key behavioral responses. And so we had all kinds of theories about how the framing of the Gallup ladder as a ladder, you make people think more in relative terms and so on. And I said, as a scientist, that doesn't make any sense. Surely we should be getting Gallup to ask the life satisfaction question also of the same people it's asking the Cantrell ladder of, and then we can solve this scientifically. Well, thank goodness we succeeded. They didn't keep it in every year, but at least they did a full round of countries. And it turns out the pattern of responses, the means of the distributions are different. The structure of the distribution is different in precisely the way that Cantrell said. He said this is a self-centering measure, and indeed it is more tightly centered around its modal point and has a narrower distribution. But from the scientific point, the magic of this is we've shown essentially you get the same equations, the same explanatory. So in talking to Amartya Sen, it doesn't matter whether I use an equation based on the Cantrell ladder or one based on life satisfaction. Unless we had managed to convince Gallup to ask both questions in the same survey, we wouldn't have been able to tell you that. On the happiness side, coincidentally, and we haven't got it completely wrong together, the European Social Survey wisely asked both the life satisfaction question and the happiness question on the same scale. You see, people that had different results about happiness and life satisfaction based on the World Values Survey, where both questions were asked but on different scales and in different forms. So what the European Social Survey did is use the evaluative forms of the happiness question and life satisfaction together in the same survey, and then we were able now to say, just as we saw yesterday, you could look at the results for happiness and you can look at the results for life satisfaction, but more importantly, they're independent measures, independent evaluations, not completely independent. Of course, they're by the same person at the same time, of the same life, but they're phrased differently and asked at a different point in the survey. And the correlation is not 0.9 between them, it's 0.6 or something like that, as re-asks, or 0.5, as re-asks often get in this field. If you then average the two measures, the signal-to-noise ratio rises, and in fact, the explanatory power of the underlying models is improved. So you get some gain from multiple measures of the same evaluative sort, but the important thing is that having some surveys, at least, that provide these multiple measures, am I speaking too fast? Some surveys that provide these multiple measures allow us to find out what are fundamental differences and what aren't. The fundamental difference is between these emotional measures, the affect measures, both positive and negative, and the life evaluations. And we know that not only because there are weekend effects in the affect measures and there are none in the life evaluations, but when happiness is asked as an affect question, as it is in the UK surveys they've now just started, they put in happiness, well, how happy were you yesterday on a 0 to 10 scale? So then we can see how the modeling of that compares to the modeling of happiness about life as a whole in the European Social Survey. We don't have them in the same surveys, but UK is, anyway, there are ways of making it pretty close. And they're quite different. So just as Amartya Sen and I and our philosophical leaders would suggest, people are very good at hearing the question you're asking and answering the question you ask. And if you ask them how happy they are as an affective response, they'll give you one. And it will be explained by what's going on in the affective life of those people now. If you ask them about life as a whole and how happy you are with it, they will answer in precisely those terms. This is an audience mainly of people who are statisticians and interested in collecting data. So I'm spending more time than usual on the actual, what the numbers mean and why they mean it, and why you should have, why they should have for you scientific credibility. I will give you one more bit of result that shows you how good people are at watching what you're asking and answering the same question. A lot of pollers, and I found a lot of resistance among national statistical agencies to subjective questions in general. I think we're past that now, but still people are perfectly aware of how important context are, and tricky things about a question can actually change the responses quite a lot. So there is a health question that's traditionally asked, 5-point responses. So what is your state of health these days, from 0 to 5 or 1 to 5? And some of my skeptical colleagues said, I think that's too vague. Let's ask in this Canadian survey we ran, how good is your health relative to other people your age? So at least they had a comparator, and they could say, who am I comparing myself to? And so other old, whatever they are. And what did we find? In the straight questions, which are asked in surveys all over the world, there's a strong age relation. So the scores that people give of their health go steadily down every decade from the 20s on. In the survey where they were asked relative to their age, that everything else in determinants was the same, but the age factor just disappeared. Now, what's that telling you? It's telling you that people are very good at not only judging the state of their own health, but comparing it to the state of other people's health, whether measured by what they see or what other people evaluate for themselves. That's very powerful. So just small, careful wordings, it means that you can really put quite a lot of evidence, quite a lot of power in these. But we still have to remember context is really important. What have I learned in positive psychology and psychology since I have entered the field? I've learned how important social identity is, how people can do almost anything if they're convinced that it's the right thing to do to serve a purpose, and that they're malleable in terms of the context in which they think they're operating. And here's an example to prove it for you. Canada's had life satisfaction questions in the general social survey of one form or another for 20 years or more. And it's asked in general social surveys that have different main topics. And we first noticed about 10 years ago that the average answers in the survey where the subject was time use were lower than they were in the other general social surveys. And so that then opened our ears, and we didn't know quite what to do about that. But since, of course, we've had another round of time use survey, and we've had other surveys asking the same question on the same scale, but set up in the same way and administered to the same nationally representative sample, so there wasn't much in play except this survey context. And we found it to be both large and empirically important. So the average scores on life satisfaction, when it was asked in the context of the time use survey, were about 0.4 points lower on a 10-point scale. Well, as you know, that's big relative, that's a multiplication of income by at least 2. It's a big deal. And so now we had general social surveys of various sizes, and we found that these contextual effects were important. There is a famous paper you may have read by Angus Deaton where he used the Gallup poll, and he saw how different the latter responses were when they were asked after how happy are you with your government kind of questions. They were much lower when people had been asked the political questions first. And that led a lot of people to be skeptical about these answers. So if they flop around according to where they're asked, then how primary are they? And so it's very important for us statisticians. It's a big deal to be able to assess this thing. So that was very valuable. I mean, first of all, that was overinterpreted, that thing, because of course they were wise enough, Gallup, to keep other people asked, so they knew exactly how to determine the size of that effect from that ordering. It was done for experimental reasons in the first place, and it was easy enough to standardize it out of the data. But you have to keep your eyes open in order to do that. So we then pooled the data from all these different general social surveys. We found very stable differences. The one I just talked about, the two time use surveys, everything else equal, we were explaining this with the whole time series of data about macroeconomic and other kinds of determinants of life satisfaction. Being in that context, so of course the hypothesis immediately was, we already know that people who are subject to time pressure are less happy than those who aren't. And people in the context of this time use survey were focusing on time crunches. And once you focus people on time crunches, of course, then they think about their time crunches. On average, they have time crunches, and so they're less happy having thought about that. That's the hypothesis. Well, we were able, fortunately, in a very recent paper, to nail it down even more strongly than that, because as you also know, there's a U shape in age, where you start out happy and go down, least happy about the age of 45 or 50, and then this is essentially every country of the world, and then rise thereafter. And it turns out that if you look for the U shape in age for people who are not employed or for people who don't feel time pressures, asked it as a separate question, it almost disappears. And so it quite clearly is related to time pressures. So we proved that on other grounds. So then we went back to the time use survey and the other GSS and looked at the U shape. And sure enough, in the time use survey, the U shape was deeper, which is telling you that the reason the people whose scores especially go down when the question is asked in a time use survey context are precisely those people for whom time use pressures are most obvious. So yes, it is a context effect, and of course it can be adapted. Just as I told you for the happiness versus life satisfaction, it's true for the two surveys. We simply put in a constant term, and everything else is, they give exactly the same responses for almost every other effect except for the U shape in age. So we can pool them. I'll give you one final contextual one because it's more amusing than anything else. One of the other surveys was a criminal victimization survey. Well, you might say that that's going to be a downer, that people will have lower average values. Surprisingly, though, their average values were 0.3 higher when the question was asked in the context of the criminal victimization survey. And why was this? Well, further research showed that you were asked a whole lot of questions about, have you been a victim of the following kinds of crime or attempted crime over the past year? And then you were asked, how likely is this to happen in the next year? And people uniformly, almost, replied they hadn't been subject to crime, and they uniformly almost thought they were likely to be in the next year, or at least more likely than they were in the past year. So, of course, they felt they were lucky in this past year, because although whatever the risks of crime were, they'd managed to, through their own lives or good luck or good management, to skate through it, so that it was, for them, not an issue. That is related to a lot of the other literature, which I'll try and get to in a moment. I have a tendency for talking longer than I ought to, because I find this material so interesting, and I sometimes forget the audience may not feel the same way about it. So this is called Taking Happiness Seriously, because somebody for whom I talked said that was a nice title, but it really isn't, because it should be fun to be able to talk about happiness. So I'm going to go through very fast, because I do want to interrupt myself again. In my view of the sort of structure of this, is that I think we're now, although I've spent all my time so far talking about measurement, we're at a stage now of acceptance of the importance of these data and the need to measure them, that in fact we ought to be using what we've learned on the understanding side in order to talk about things to improve lives. So I know that's part of what we're talking about at this seminar. So on measuring well-being, what I'm going to report are data that we put in the First World Happiness Report. This is one of the few print copies around, but it's available online should you wish to get it. Essentially, we drew together all the available multinational sources for well-being and positive and negative affect, and tried to do our best to survey the literature explaining them and to deal with the policy implications thereof. The measure we use is the Cantrell ladder, because that's the one that's in the world poll. Ed told you enough about that yesterday. I don't have to explain any of that, but I will just give you a little more of the country rankings that he did and a little more of the explanations. So this is a map rather like his map, only in finer gradations. And then this is something that's going in this year's World Happiness Report. Last year, we essentially had bars showing the average happiness over the previous 5 years, because you have to get a fair averaging, because it's only 1,000 a year in order to get those standard error bars down enough the rankings don't jump around too much every year. We then find the same variables explain happiness differences across individuals and across countries. And this in particular, these results I'm going to be talking about now, are actually using to explain differences in country averages. Well, they're in big script, and there's 6 factors, and you can see they are the ones of which I was speaking when I started. The first 2 are in the UNDP index, and the others are arguably key measures of capacity, capability. They're not necessarily measured, and there's someone to count on, which is critically important. There are a lot of different ways of measuring the quality and intensity of your network of family and friends. Just having someone to count on is a very weak measure, because it's met for almost everybody in the world, but it's the only one we have for the survey, and it comes out, as Ed showed you yesterday, the strongest variable of all 6. It doesn't get into the capabilities approach in the same way, but I think it belongs in any human-centric approach for sure. The absence of corruption, the trustworthy, that's part of the capabilities approach. In this case, measured by the average of perceived corruption in business and government. I much prefer to have people self-assessed measures of the trustworthiness of the environments in which they live, in their neighborhood, when they're dealing with police officers, when they're at work, because all those dimensions are critically important to their happiness and go much deeper and in a more insightful way than just asking about on a 0-1 scale whether corruption is an issue or not. So you need more finely graded answers, and you really need to dig into trust more. I'm now giving you advice when you're considering your next surveys, rather than I've been unable to get Gallup to go as deep as I think they are in this context. Generosity is new. It's not in the capabilities approach, but I keep finding new things to excite me. If the evidence is strong enough, then I come and beat a drum for it, and generosity is a drum I am going to beat, because no one has talked much about it in this seminar, but it turns out to be of fundamental importance. People are simply happier when they're living in a society where everybody is generous. And they're happier when they themselves are generous. Let me give you one experimental result that we're in the middle of now, where another big issue, of course, is inequality. People talked yesterday about needing to think of another dimension. We'll talk about the level of subjective well-being, and then we'll talk about its distribution. If you've been following or doing the literature on this, the link between the Gini coefficient of income and average happiness across countries is rather uneven and weak. It's not nearly as strong as you'd think from reading Wilkinson and Pickett. At least I can't find it that strong. But there is a strong link between, as you'd hope it would be stronger, between the distribution of well-being and the average level. Now, there are technical reasons for that as well as substantive ones. So trying to follow that up, because I believe in research terms you should be having a triple threat when you're doing happiness research. Big scale survey research, which could be at all levels, field trials where you're testing different things in the real world of program delivery, where you're harder to get nice controls, but more important because it's real life, and then laboratory style tests. And they should all tell the same story if you really want to have a powerful answer. So to buttress the scientific evidence we're getting about inequality of well-being being bad for average well-being. In other words, do people like inequality when they see it? And our proposition is probably not. Although remember, there are Jones effects here that are not absent in the world. So the context we're doing the science is where relativities of being not happy when someone else has a big car exist. So we nonetheless find in these lab experiments we've been doing that people are, if they sort of win this random process, they're happier if they win the process and get the money, but if they've won, they like the other person. You know, their partners in teams who are in the lab at the same time, they're happier if the other person wins too. So they don't want to beat the other person, they want to get, as it were, the reward. So that suggests some evidence of inequality aversion. And as would follow from other theories, if they lose, then they're happier if the other person loses than if the other person wins. So that's inequality aversion would get you that. But so would relativity. So we did these experiments. Then we said, do you want to do a gamble and double your money, or better than double your money or not? And most people took the gamble. And then we finished. We were measuring happiness at each stage of the experiment. Then when we finished that, we had what now seems a brilliant decision, but seemed kind of accidental at the time. We said, why don't we put at the edge of the lab, when people are leaving, an envelope and a sign that says, in our lab, we're collecting money for a charity to buy, an organization to buy anti-malarial nets for children in Africa. And we find the evidence is these are pretty effective, that $10 will buy a net that could save a life. So the beauty of this is generosity has no feedback to the person's own life, so it's free of all those skeptical comments about it. And nothing else, just that possibility. And all of the money and gains that the students got in this, the best thing we did for them was to give them the chance to give their money away. The students who gave, some students not only gave all the money they won, they went into their pockets and got some more money and gave it to them, or even if they lost, they gave money. And that explains a rather substantial average difference, because most people did it, 80%, in happiness from the third stage, after they had all the gains, to the fourth stage, happiness went up. And if we looked at the end, the people who got the money and given it away were much happier than they were before they started the experiment. The people who gained the money and not given it away were no happier than they were when they started the experiment. Well, that's an extraordinarily strong result. It's a reasonably big sample to boot. It's really saying it isn't all about taking from somebody and giving to somebody else. That's not the redistribution that as human beings we're programmed to deliver. We're programmed to deliver and get happiness from sharing with others. And that's quite an extraordinarily strong result. And if we don't assume it if we don't know it if we don't look for it in our research, we won't find it in our evidence. And if we don't find it in our evidence, we won't be able to convince those who think that it's all about dog eat dog, and number one is first, and income is what you need to give to motivate people. Why would you offer them the chance to work with others for the benefit of others? They're after money, so they, etc. We find in these experiments that is all importantly false, not just false in an experimental context, but big time false. So the increase in happiness these people got from the chance, having the chance to give something away and taking that opportunity. Because remember, it shouldn't count at all if the actual triggering didn't matter, because they always had the chance to give the money away. But the point is, you made it easy for them and gave them the opportunity. They were glad, ex post, to have had that opportunity and took it. The happiness differences that were explained by the giving were more than the cross-sectional differences in happiness in these people at the time the experiment started. So the combinations of heredity and environment and all these determinants of happiness across individuals were smaller than the effects that you were getting from this. So they're not inconsiderable. Well, I've almost used my time, but I hope to good purpose, because this isn't in the report, these things I've been telling you about, but they ought to be in your minds, because I think they're where we're going. So we start at the top, and you see Denmark at the top, and you can see these 6 factors are all important. You watch what's happening. This is going to be a little an eye exercise for you here. I'm working you through the 6 leagues of the world happiness, and you'll watch as they narrow, and all the bars are narrowing as you go down. Income is an important part of the story, but is nothing like the whole story. Income is, in the top 4 countries, income is 30 times higher than it is in the bottom 4 countries. But everything else is better too. Now, that same chart without the explanatory bars is in the World Happiness Report, where you can download it and read it. So I'm not going to read you out the specific countries. The explanatory bars will be appearing in this year's report. Now, this is explaining between top and bottom what counts, and we'll do that in this year's report too, and I don't have enough time to use it to take you through that. Let me, on the way to my 2 minutes on specific policies, talk about the importance of trust, because this is in a workplace environment, and we found that one of the single most important variables explaining life satisfaction, not just job satisfaction, but life satisfaction was, in general, can management be trusted in the place where you work on a scale of 0 to 10? And it was marginally more important than the other measures of trust, although all were important. Interesting difference here, their gender differences appear in a variety of places in subjective well-being research. This is one of the strongest ones. That women care less about money in the job than men do. They care more about the trustworthiness of that environment. And so the compensating differential, how much does it matter relative to average wages? It's more than 40%. Change in wages has the equivalent of a 1-point change in a 10-point scale of trust in management for women, about half as much for men. That's supposed to open the eyes of people who are either working in workplaces or running them. We also find that women, because of this difference in values, and this is a sort of validating information, women actually find themselves more often in high trust workplaces. So they vote with their feet. That's evidence that these aren't just casual judgments. These are, in fact, what's making people decide what's the job they want to stay in and why. This is another thing on trust, and this is much more linked to my how many minutes have I got now? It's down to 2?
2 minutes.
Yeah. Is that because of the way the media work, people, their happiness is dependent on their perceptions of how trustworthy other people are. The difference between actual and perceived situation has become large and in the wrong side. So that on average, because we put a dropped wallet question in major Canadian social surveys, we know that people think there's a 25% chance of their wallet being returned if it was found by a stranger. 20 wallets were dropped and 80% of them were returned. Well, people are really happy if they think their wallet is going to be returned, but they don't know how lucky they are to live in the cities they live in. So there's no purpose in that gap between them. If people are needlessly trusting, that's bad. But to be needlessly untrusting is even worse, because it makes you unhappy and stops you reaching out and making the social connections, which you can see, from my perspective, are the fundamental driving point of happiness. So a lot of public policy should be about creating places and spaces whereby people, in fact, can connect with each other in more positive ways and build the kind of trust linkages that build happiness. And I've got lots of specific examples, but I'm going to stop talking now because it's time for you to ask questions of me. Thank you very much.
Thank you very much for this wonderful presentation.
Muchas gracias por esta interesante presentación.
Unos minutos para algunas.
Now we'll have a few questions and answers.
Les pido
So I ask you
que las tienen por escrito, me las hagan
to please just pass me a piece of paper with your questions, or you can also ask them out loud if you prefer. Okay, we have a question here. The question is the following. Well, Sergio Gallegos from the...
Are women happier than men? Is there any evidence? It's a general question. I think that we can pick 3 or 4 questions at a time and then give you the microphone to answer. La siguiente pregunta.
Next question from Arturo Pérez Arredondo. When we measure changes in the affection balance and life satisfaction of a victim of crime, how would it be possible to reduce bias or to control according to context? That's the first question. Okay, there's another question here. In the case of victims of crime, could the context affect and hide the emotional state of the person surveyed? Okay, so we have 3 questions here.
Were the last 2 questions from the same person, or were they?
Yes,
Yeah, okay.
yes, they were from the same person.
Okay, well, I'll start with the first one because it's easier. The gender effects generally favor, on the life evaluations, generally favor women over men. On affect, women tend to have more negative affect than men, and often sometimes less positive affect. So there is a difference between the affect measures and the life evaluations. It's one more bit of evidence that in fact the life evaluations and the affect measures really are tapping into different things in different ways. In my comparative studies of well-being and suicide, we end up going into that in quite a bit more detail because there is an additional puzzle there that attempted suicides are twice as likely among women as men. Completed suicides are 4 times as likely among men as women. This is across the world. And the attempted suicide typically doesn't have the same ideation of death, and it is much more an affect response, while suicide completed is, of course, the ultimate measure of hopelessness, which is a life evaluation of the most fundamental and extreme form. So there is, in the real world of suicide, there's an exact analog to what the hypothesis or the results I just gave you about gender differences in affect. People, when first seeing results out of the Middle East, were very surprised to see that women are happier there than men as well. I was just in the United Arab Emirates talking in the big conference, and then a meeting in the Prime Minister's office about this. And of course, the staff there were, whatever you may think, the staff there in the Prime Minister's office were half women and half men. And they weren't at all surprised, either the men or the women, to find that in the United Arab Emirates, the gap between female life evaluation and male life evaluation is bigger than it is in Western countries, and of the same sign. On the context effects and measuring the consequences for well-being of being a victim of crime, I'm going to take the easy way out, just to say I've studied a lot of detailed questions with this data. I have not used the criminal victimization survey in that way, and so I can't really tell you, and I won't guess. But it's an important thing to look at. What I was getting out of criminal victimization surveys, and where I have used them in many countries, is for the following purpose, is to say, what is that makes people unhappy? Is it the existence of crime where they live, or is it the perception of the existence of crime? So from these criminal victimization surveys, we have measures that differ by country of actual crime, people's own experiences averaged, and perceptions of crime. And we found, as we expected, that it's the perceptions that are the things that determine the international differences in subjective well-being, and not the actuality.
Gracias. Pasamos a la siguiente pregunta formulada por José Ramón Garrido del Centro Mexicano para la Filantropía. ¿Cuáles son las pruebas científicas de que la filantropía, como donar, trabajo voluntario, cuidar de alguien enfermo, genera felicidad? ¿En dónde puedo consultarlo? ¿Hay alguna otra pregunta? Otra pregunta de Gerardo Leiva, del INEGI. ¿Cuáles son los 2 o 3 principales usos de la estadística de bienestar subjetivo en las políticas públicas? Cerramos entonces la ronda de preguntas y damos por última vez la palabra al profesor Helliwell.
Thank you very much. There are two kinds of evidence on the effects of let me give you some of the experimental stuff on caregiver effects. There is, in a lot of the care literatures, there's been this talk about caregiver burnout and a whole range of those things, a lot of emphasis on the costs of giving care, and that's, it reflects, if you like, the holdover of the previous mindset. And so, consistent with that, there were a number of studies of the effects on cancer patients of setting up peer-to-peer advisor relations with previous cancer sufferers. These are female breast cancer victims in the main. And they found quite substantial effects on for the recipient of this peer support. Only a year or two after the original study did they think of asking, what are the effects of this process on the givers of the care? Are they getting frightened by having done, because they're previous sufferers themselves. And they went back and found the positive effects of the dyad, the caregiving receiving relation. The positive effects for the caregivers were much more and much longer lasting than they were for the recipients. Despite all the preconceptions. So that, to me, is very strong. And it's been found now, time and again. People now are attuned to this. The idea of generosity and altruism actually being powerful drivers of well-being is new enough. We're still fighting the selfishness model in some sense as a producer of hypotheses to test, that we're now starting to see more experiments set up to look for these effects, and indeed they're there to be found. There is quite a lot of survey-based literature that takes these various acts, like the donation that was used in the Gallup poll, they don't tap into what I think is the fundamental issue, which is not so much whether you've given the money, but the link between that and your own personal connection with what's happening. I think what's really important in giving is not just that you're giving, it's that you're giving to something you value and is important. And it's your volition. So it's the freedom, it's the efficacy that it's going to help, and it's in a valuable direction. And our research so far has not done very much about parsing those distinctions. And I think it'll show much more powerful effects for the directed volitional ones. And it's, if you like, more evidence in favor of this notion to exploit and empower people's desire to do things for others is much, much more happiness producing for a nation or a community than taxing the rich to buy something for the poor. That's bad for the rich and it's bad for the poor. So it's this question of enabling people. Now let me turn to the second question, because that's a natural thing. Most of our public policies are based on the latter presumption. What services should we be raising tax revenues for to provide for people who need them, and not even thinking about what's going on in the minds and hearts of the people who are receiving these services and providing them. And Mariano spoke in that nature yesterday, that it's the social context of that care delivering process that is all important in producing results and in everything else. So I can give a couple of examples if you want, but the idea of the examples is to show these are universal propositions. These are not specific to a country. They're not specific to a care environment. People were moved from one elder care facility to another, and there had been the happy floor and the unhappy floor, and they asked the people in the happy floor, they weren't asked, they were given professionally designed social spaces in the new building. The people in the unhappy floor were asked to design their own social spaces, and they did so. And the professionals looked at what they produced, and they said, this is crazy, they'll never use these social spaces. Of course, as you can imagine, because I'm telling this story, the results were the reverse. The social social spaces that were self-designed were used 50% more than the others. The real point is, of course, it was their social spaces, what was in them didn't matter at all, that they had been brought together and they started to know each other and they started to value each other and they constructed a social identity there. Through that, I've written a paper on the Singapore prison system reforms, arguing that their form and structure were of the nature to exploit those possibilities with positive effects for everybody. The Danes have a great real-world experiments in their management of dementia patients. So the dementia patients are not patients being treated, they're people who are invited and empowered to look after themselves and each other. So to give people a purpose and a chance to do something important with others and laugh at it. I've heard a wonderful CBC radio program on this where you can just hear the laughter that's going on in the places where these people are living. And as a consequence, their dementia patients live out of care happily far longer than in other countries. And even when they're in care, eventually, these processes sometimes accumulate to the final stage, they are much healthier, they're much more active, they're much more engaged, and they're much less requiring of medical assistance than in other countries. So you save money. You see, we shouldn't have to say we save money, therefore it's the public policy defense for it. The real defense for it is this is building happier lives. The fact that it also is saving healthcare resources is a bonus. It's true. It makes it easier to make the case. But don't let the fundamentals be buried in the small print. I can take any number of public services and go through the way in which the design and delivery are done, and we have experiments in a number of fields to show that education needs to be changed, healthcare needs to be changed, the justice system needs to be changed, conventional, everything from post offices to anything else needs to be changed. You have to sort of build connections is really what it's about, and then assume what we're now finding out about the good aspects of human nature, and that will make them more prevalent. See, these prevalence results I'm giving you here are in a context where people are taught to be skeptical. They're taught to be suspicious. They're taught to assume the worst about each other. Just imagine those beliefs changing, how much more positive reinforcement there could be in these already rather significant positive behaviors. Thank you.
Thank you very much, Professor Helliwell. I am sure that the audience is happier now that you have delivered your presentation than before.
Now that it's over, you mean?
And no, because of your presentation. And I hope that you are happier after having attended this seminar than before coming to visit us.
I'm delighted to have had the chance to be here, and even more delighted to have been here with you this morning. Thank you so much.
Thank you so much.